Major support for Do the Math has been provided by Chevron, the Kern County Superintendent of Schools, Edison International, Valley Strong Credit Union, California Resources Corporation, Bakersfield West Rotary Stroop Family Foundation, Panama Buena Vista Union School District, Bakersfield City School District, Kern High School District, and AC Electric Company, with additional production assistance provided by these supporters of education in Kern County and throughout the state of California.
We're here at Ming H Drugs today. We're going to talk with Pat Person, pharmacist at our place of business here that we're visiting. You know, people like to talk about a new normal, and what's going to be really interesting is talking about how not only our world around us is adjusting and the shifts we're making, but also how we're using the skills of the math classroom and your learning to apply that skill set to how we interact with our world. So right now, I'd like to take the time to introduce our guest today, Pat. It's good to see you. How are you?
I'm great. How are you?
It's been an interesting time, and you know, looking at a lot of our businesses locally, especially you know some of the types of businesses like yours that heavily weigh in, not just in medicine, but on interactions with the public. Tell us a little bit about the adjustment.
Well, we've had to make a couple of adjustments in the fact that every person that walks in the door, we have to temperature test. We go through the gamut of questions. Have you been around somebody who's been sick? Are you feeling sick? Have you been tested positive for COVID? Things like that. We've seen our number of home deliveries have increased because people are afraid to come out. Obviously, everybody in the store is masked. We're just got to the point recently where we're making it to where people have to wear a mask to come in. A couple of months ago, it was kind of, you know, do whatever you felt comfortable, and now going along with everybody else, we're just saying masks are mandatory. And, you know, we're just taking a few extra precautions. We have a ton of hand sanitizer and stuff. Thomas, my son, he manufactured some hand sanitizer and we made it available. So just cool stuff like that where we can still use our skills, but make sure we're trying to keep our patients safe too.
Now you mentioned this skill set. For those that aren't quite sure what the role of a pharmacist is, I think when you think very young, the only time you really interact with a pharmacist is to pick up medicine. So what does a pharmacist do other than simply just distribute?
Well, that's a really great question. I mean, if you look at, I've been a pharmacist for a long time. Hard to tell, I look so young. But the world of pharmacy has changed dramatically just in the 30 some odd years that I've been here. Back when I started, the pharmacist job was product preparation. That's all we did. Count pills, put them in a bottle, put a label on it. We weren't even supposed to talk to the patient. That wasn't our job. That was the doctor's responsibility to tell them about the medication. Fast forward to today, these kids that are coming out of pharmacy school, like I said, my son just graduated a couple years ago, they're being taught all these clinical skills. They're being taught all these things on how to manage patients and how to manage medications. It's not about product preparation. We have a whole different class of pharmacy professional, the pharmacy technician, who is responsible for, typing the labels, doing the filling, stuff like that. They do the product preparation. We do the final check. We, check for drug interactions. We make sure the medication that's been prescribed is safe for our patients, that it's 100% accurate. So the things that we do is no longer about putting a pill in this bottle. It's about making sure that the pill that's in that bottle is going to give you the optimal benefit for for what you need.
I know one of the big pieces of conversations whenever there's picking up medicine is, do you have any questions about this? And that's become kind of the standard. And a big part of that conversation sometimes can be, the role of math and understanding not just numbers, but rates. The idea of a certain amount per day, every 6 hours. There's a lot of that terminology that gets used in the conversation of pharmacy.
Well, that's true. I mean, everything we do is based on a prescription. Every prescription has a daily amount that you need to take. You look at the entire amount of the prescription that we're dispensing. We have to calculate how long that's going to be expected to last. Our big thing right now is insurance billing. If you bill an insurance company, their main question is, how long is the prescription that you're filling going to last for that patient, so we know when we're going to have to pay for it again. If we make a mistake on that, the insurance company catches us. Now they come in and say, you know what, you guys screwed up, we want our money back. So it's not only it's an impact on the patient, but it's a financial impact for the pharmacy as well.
So we're going to take a look at that with Pat a little bit later on. We'll look at the actual medicine itself and take a look at the role that percentages as well as different rates of measurement and different units play as well. And then we'll talk a little bit about how to calculate some of those rates for something like what Pat mentioned to make sure that we know exactly when a certain amount of medicine is going to run out. Back here at Ming H Drugs with Pat Person, our pharmacist. Before the break, we talked a little bit about the role of the different types of units and how percentages might play into working with medication. So let's come on in and talk to Pat and see what we have lined up here. So we were talking a little bit about the different types of units that you might encounter on different medications, and a lot of it falls under the metric system, but under really small amounts that maybe students watching may not be familiar with, as far as something being like tangible enough that you can hold in your hand. So kind of describe some of the standard units that we might see in medications.
Well, exactly what you were saying. The medical profession, at least with pharmacy-wise, we're probably between 85 and 90% metric system. But it doesn't mean you have to know the full gamut of the metric system. The numbers that we deal with are very minute. We go kilogram, gram, milligram, microgram. That's about it. So that's 4 different settings that you have, and each one has a set number of decimal points in between. So it's really easy to learn. It's not having to learn all these different in between kind of stuff. So learning the metric system for the medical profession, pretty simple. However, with a misplaced decimal, you've got some serious issues.
So I wonder if there is a purpose behind, you mentioned those 4 units, and that's something I kind of noticed a pattern in, going from kilogram to gram to milligram to microgram. I noticed that the interval somewhat changes each level that you move along that scale. Is it about 1,000?
1,000 per each, correct.
So I think it's interesting that they keep that standard, how you go by a multiple of 1,000 one way or the other as you move up and down that. And that's fascinating. And I think a lot of times, especially with students that are trying to navigate the values of metric, they might hear milligrams and milliliters and confuse the two. So if you could explain to a student who's trying to figure that out, what would be like the best understanding of the difference between a milligram and a milliliter?
Sure. Milligram is weight, milliliter is volume. So milliliters are going to measure liquids, milligrams are going to measure solids or tablets or things like that. So that's how we get that definition.
If you think of like a 2-liter bottle of soda, like that's going to be a liquid. So like some of these measurements here that are in a box, if you open them up, those are actually liquids in there.
Correct.
And then the grams, those are solids. So milligrams would be things that are like pills or powders.
True. And then what you can do too is, like, I've got an example here where we get a prescription for amoxicillin liquid. It's 500 milligrams per capsule. But if you got a patient who's can't take a capsule, maybe it's a kid, well, you've got the same medication available. It's amoxicillin, but now we can turn it into liquid form. So, but we have to be able to take the dose that was ordered for here and calculate how much of this bottle to turn it into to get the exact same dose. But it's still this is milligrams per teaspoon, this is milligrams per capsule. It's still the same measure, it's just a different dosage form. This is liquid, this is solid.
And so you can see how important it is to understand the difference between those two and making sense of how much of one amount. And I think it's interesting that you identified 5 milliliters as kind of the standard for what people think of as a teaspoon.
Right.
Now, on some of these, we also notice on some of the liquids here in milliliters that there are some percentages on here.
Correct. And luckily these are pre-made, so we don't have to do anything other than just go to the shelf and pick it off. But most of your creams, ointments, these are eye drops. This is a topical antibiotic that you use for acne. They're all measured in weight per volume, which is the percentage weight. Over here I've got an inhaler, which is a breathing solution that's got the dual measurement. It tells you that it's a 0.083% solution, but it's also telling you that there's 2.5 milligrams of active ingredient per every 3 milliliters. And if you open it up, well, of course I got the one that's closed, but inside here are little plastic containers, and each one of those little plastic containers is a 3 milliliter container. So it tells you that you're going to get 2.5 milligrams of that medication in every one of those little containers.
So understanding those units is going to be great for understanding exactly how much medicine you get in each dose or each pill. But if you want to go longer term and know how much medicine you have and exactly how long it's going to last you, that's another level of understanding rates. We're back here at Ming H Drugs with Pat Person, pharmacist. Last segment, we were talking about the role that units play, especially metric in medicine, and the relationship of how rates can help us understand how much is in a dose. And Pat, you showed me a really interesting tool that pharmacists pick up in some of their university level classes as far as how to calculate exactly how much should be in an estimated supply that a doctor might prescribe.
Yeah, so basically our whole world revolves around how long a prescription is going to last. Somebody brings in a prescription, we dispense a certain amount. We like to know or kind of get an idea of when we can expect to see them back again. So we have what's known as an estimated day supply that we have to calculate. Insurance companies base reimbursement on estimated day supply. If I say that it's going to last 30 days and a patient comes in 20 days after they get it, the insurance company kicks it out saying that it's too early. If it's a 30-day supply and they come back 45 days later, then there might be some issue where the patient's not taking the medication correctly, and all of a sudden you've got an issue about non-compliance. And if you're non-compliant, you don't get the best benefit from the medication. So what we do is we have all of our technicians and everybody that works in the pharmacy has what's known as the estimated day supply, or the EDS calculation, where you take the amount of medication that we dispense, you divide that by the amount of medication they're using per day, and you come up with an estimated day supply. Just like if you had $10 and you're spending $1 a day, how long is that $10 going to last? Same kind of thing, but we're using it in the amount of what's going into the dispensed medication for the patient.
So this can work as a formula in and of itself, but it can also work out as a proportion that you can use to calculate longer terms of prescriptions, let's say if it needs to be extended by multiples beyond what's originally prescribed.
Sure. So if let's say I've got 30 in a bottle and the patient's taking 2 a day, and I calculate that to be a 15-day supply, but the prescriber wants the patient to have 30 days. It's just take that factor, multiply it times 2. Or the doctor prescribes a 90-day supply, but the insurance company only covers a 30-day supply. We take that quantity and divide it by 3 to get the 30 days. So there's a lot of things that we're able to do based on what's prescribed, what we're dispensing, what the insurance company is going to reimburse, and that kind of thing.
Now that's generally easier to do when you have something solid that's quantifiable, like a pill or a capsule. When it comes to something like a liquid, where you don't necessarily go by milliliters, but a doses in something a bit more, I don't want to say fluid, but a bit more undefinable, like a drop.
I was going to say vague, but that works.
Yeah.
Okay. Well, that's a great question. So here I've got a prescription for an eye drop. This is an eye drop they use for inflammation in the eye. But you'll notice that it's a 10 milliliter bottle. But when we're dispensing to the patient, the directions don't tell them to take, 0.2 milliliters and squirt it in their eye. The directions for eye drops are use 1 or 2 drops, left eye, right eye, both eyes, whatever. So we have to be able to calculate this estimated day supply based on this bottle being converted to drops. So there's a standard measure where 1 milliliter is equal to 20 drops. So I can then take the 10 milliliters that's in this bottle, multiply it times 20. Now instead of dispensing a 10 ml bottle, I'm dispensing 200 drops. Patients using 5 drops a day, 200 divided by 5. This bottle should last them roughly 40 days.
So if you're listening to this and it sounds like a lot of work, it's not necessarily harder work, it's just more work that that you can do. And there are tools that you're able to use to calculate that very quickly. But just understanding the relationship of doing one rate conversion and applying that to a formula to figure out how much to inform the insurance company about is going to save you guys a lot of headaches.
Yeah, and the great thing about what we do is we have references here all the time. I mean, if you look at, we have pharmacy students that are coming in doing externships and stuff like that. And those guys are living on their phones. They're looking at dose calculations based on stuff they have they go to Google, or they go to, their bases that they go to get the information. So back in the day when I first started out, it was a calculator, we had to just go off memory. But of course, we're dealing with a lot of the same number of drugs we have today. But like I said, the transition of pharmacy from a product base to a clinical base has caused these new pharmacists coming out to be much more well versed in all the little minutia that goes with the profession of pharmacy, not just, here's a bottle of pills, count by 5 until you get 30 and throw them in a bottle.
Well, Pat, thank you so much for having us today. As a token of appreciation from Do the Math for having us, we want to award you with the customary traditional Do the Math tile.
Awesome.
Do what you will, display how you can, and we wish you nothing but success here, and thank you for the work you do in supporting the community during a tough time like this.
Yeah, well, thank you guys for coming by. Stay safe.